menopause is one of those things that has sort of been talked about lately so much. And I think that's probably one of the blessings of all the social media and all the noise, which comes with a lot of negative sides as well, but that we finally are going to or promoting talks that are very overdue. But there's so much also contradicting advice out there, so many people saying something. What have you, in your experience, really seen as helpful when it comes to preparing for menopause or even the times before perimenopause?
So I have a special interest in women's health and longevity. And I deal with women who are perimenopausal, menopausal, and I prescribe them medication to help them through it. And I advise them as well. And there are a few things that I have certainly seen in practice which can help women. And one of them is weight optimization. If you are of perimenopausal age, it is very likely that once you do reach the menopause, you gain weight. And for some women, it becomes inevitable. And the average weight gain can be anything between 3 to 6 kilograms, which in England we call 1 stone. So 6 kilograms is considered as approximately a stone of weight, which is a lot of weight.
Yeah.
And this then has a compounding effect on your bone health. It has an adverse effect on your cardiovascular health. And in general, it makes you feel sluggish. So, the one advice that I would certainly give all women is that it's ever so important that you do 150 minutes of exercise in a week, that you exercise to the level. It should be cardio and weight training, so strength exercises are very important because the exercise should be of the level that your heart rate goes up, so you should be a little bit out of breath while you're exercising. So that's really, really important. And we must look after ourselves by monitoring and optimizing our weight. We've certainly seen that when it comes to women who are overweight, their symptoms are debilitating. So they'll have lots of hot flushes. I'm not saying that, women who have a normal BMI don't have these symptoms, but what I'm trying to say is that they can be far worse if you're massively overweight as well, because that is another risk factor that you've got. And so it's really important that you do look after your diet, your lifestyle, your sleep. Now, we also know that people who have poor sleeping patterns are very likely to be overweight. So shift workers like myself, I used to be a shift worker when I was a junior doctor, nurses who work in hospitals, hospital clinicians, doctors, people who do night shifts are at risk of being overweight. And that is because their sleep is not optimized. So sleep has a direct link with your weight. So it's extremely important that we understand our health. We have good quality sleep at night. Blue light affects our melatonin levels. Blue light, for instance, if we're on our screens, our telephones before we go to bed, that has a bad effect on our hormones. We need to stop doing that. Now, I see lots and lots of parents who are frustrated. They bring their kids into my clinic and they'd be like, doctor, this child, they're always tired in the mornings. They don't want to go to college. They don't want to go to school because they can't get up. And when you take that history, that detailed history, you find out that they're using their screens up till they fall asleep. Of course, their brain is going to be wired then. It's going to be very difficult for them to have a good quality sleep and be able to unwind, because the idea of sleeping is that you recharge yourself. How are you going to recharge yourself if your brain is again firing at 100 miles per hour because you've given it all that stimulation before bed? So, it's little things we need to do which are not impossible. I mean, people 100 years ago used to do things like this when we didn't have electricity, when we didn't have the luxury of, our smartphones and our iPads. People used to go to sleep when it was dark. If it's winter time, they'd go to sleep at 6 p.m. If it's summertime, they'd probably go to bed at like 8 or 9 or 10 p.m. and that would be it. But now I just feel that we've introduced ourselves to very unhealthy lifestyles, which are affecting us in a bad way.